right now.
Is that going to be on there?
No, there won't be any questions about the masseter or the hard palate because I didn't get any cat with an open mouth, so we're not going to worry about that. Now, there will be, probably, I will ask you about the trachea for sure. Did you guys were able to find the
Epiglottis?
Yeah, right there's the epiglottis. You see that? That's a little flappy thing. So we have a lot of cats with good epiglottises, so there's a good chance that that will be on there. Also remember that the esophagus is the part that is behind the trachea. That could be another potential question, okay? So this is the trachea right here. This is the esophagus going down the back, and you have nicely got it open right there. Esophagus, and then right here is the larynx, and then this is the epiglottis that's covering the larynx. So we got the larynx right here, which is covered by the thyroid cartilage. So hopefully you got that right on the exam today, right?
Yeah.
Okay. And then we have the trachea coming down, and then in the thoracic cavity, you guys need to know, what do you need to know? The lungs, right? That's it. We're not doing the hearts and stuff. Okay, so the cat has a left and a right lung, and there's 3 lobes per cat, okay? So make sure you understand the nomenclature that goes along with 3 lobes. So the top part is the superior lobe, and then we can easily see on this side the medial or the middle lobe, and then we have the inferior lobe over there, okay? Now the other thing that I might ask you about is the primary bronchus, and let's see if we can see it on your cat. So the primary bronchus is going to come near the back, and yeah, you guys actually have some good primary bronchuses right here. So, and it's actually this white section that's coming out, and I might go in and skin it, but right in here is the primary bronchus that's coming out.
So it's connecting
from
to
the
the
lungs. Yeah, so it's going to be in this middle area between the superior and medial lobe. So I may go exploring into your cat to check this out, okay? And then I'm seeing up on this side as well. So right here is a good one that we see. That would be a secondary bronchus going into there. So I may clean this all out and see if I can find a primary bronchus. And it's actually not that hard to do. So the primary bronchus will be a clear tube that's going into each of these lungs. So keep that in mind that that might be on the lab practical, and it's one of the things I know another cat had perfectly found that. All right, so separating the thoracic cavity from the abdominal cavity is this very long, extensive muscle, which we can see right here, and that's called the diaphragm. If we flip up the diaphragm, we now have the liver, right? So the liver's right here, and you have a very nice gallbladder. So this is the gallbladder that's behind the liver. You do need to know the lobes of the liver. So this one right here is called the left medial. This is the left lateral lobe. This is the right medial, and this is the right lateral. And then if we flip the liver all the way up on the back side, we have the caudate lobe. And of course, you're gonna be stubborn. There he is right there. This is the caudate lobe back there. Now, while we have this open, between the liver and the stomach, we've got the lesser omentum. Okay, so this is the lesser omentum right here, and that's covering the blood vessels that are connecting to the stomach, and we're going to learn about those a little bit later. Right here is the stomach, okay, and we also have the greater omentum, which is this area right here, and this is the spleen that's on the outside of the greater omentum. Okay, so we're going to flip up the greater omentum, and what we have under here is the pancreas. There's your pancreas. So this is that gland-like tissue right here that's stuck to the back of the greater omentum. Now coming down, boy, you have a fatty cat. Okay. All right.
Sheila.
Huh?
Sheila.
Sheila's fat. Is that what you named the cat?
That's on there.
Okay, I'm trying to find the connection here with your, you don't have a very defined ileocecal, there he is. Okay, so this is the duodenum coming down, and then right here is, this is all your small intestine. So for the cat, basically what I'm going to be looking for in terms of the large intestine and the small intestine is I may ask you about the duodenum or the duodenum that's coming out of the stomach. But primarily what we'll be looking for is the ileocecal valve, which is right here, and it's a snotty area right there. So when you find the ileocecal valve, on this side we see the smaller small intestine, and that's the ileum, and then on this side we see the larger large intestine, and the first region of the large intestine is the cecum. Okay, so that's what I usually go for with testing with the cat, is the difference between those. It's very impossible to determine which part is the jejunum and the ileum in this tangled mess, so we're not going to bother with doing that. And then the cat's intestine wraps slightly different than ours, although you do have a very nice sigmoid. Okay, so we have a sigmoid colon right here, and this would, of course, would be the descending, transverse, and ascending. Now, connecting the small intestines is another part of scaffolding material, and that's called the mesentery. So this is the mesentery right in here that's holding that all together. And what else do we need to know? Large intestine, cecum, colon, did that. Spleen, pancreas, we did. Greater, lesser, stomach. Okay, I think that concludes everything for the cat in terms of what you need to know right now.
Right? Colon and rectum.
We can't see that because we'd have to cut
Okay.
all this open, and that's going to be on the third lab practical, is cutting this open and
Oh, okay.
studying that. Okay?